everybody, it's Dr. Joe and Devil Remy, and today we're going to show you some simple stretches and exercises for fibromyalgia or chronic pain lying down. So let's get started. So you're going to need a few pieces of equipment before we get started. One, you're going to need either a ball or a pillow or even something like a yoga block, just something to put in between your knees to squeeze into when we get to that exercise. And then you're also going to need a strap of something, like something solid. So a stretch strap, a belt, a dog leash if you have something like that, but not the resistive bands because you want it to be something nice and solid. So the key with stretches and exercises for fibromyalgia or chronic pain in general is find out what your happy medium is. You want to stretch and exercise, but you don't want to do so much where you're going to end up getting a flare up. So these are just nice, gentle exercises. They're all going to be lying down. Let's go ahead and lie down and get comfortable. So the first one is just going to be a simple trunk rotation. Trunk rotation is kind of just like it sounds. So you're going to put your feet and your knees together. Once you've got those together, you're just going to nice and gently roll to one side. You should feel a stretch right on kind of the side of your body here, maybe a little bit into the back, into the hips. You might even feel it at the knees if you've got a tight IT band in there. You can do this for a stretch where you're holding it for a full 30 seconds, or if you want to kind of do it like an exercise and just do a pause for 3 to 5 seconds if that full stretch is too much, and then just come back up and then switch to the other side. So again, I'm feeling that stretch right through here. On my left side, I'm feeling a little bit more in my hip just because I do have some hip tightness and things like that. And again, you want to just go to your comfort level. So if you can't bring your knees all the way down, if that's too painful or uncomfortable for you, that's okay. You can just go to whatever is comfortable for you. Ideally, if you're doing a stretch, you want to do 3 on each side for 30 seconds. If you want to just do a short hold, you can do it just maybe for reps, or if you want to do 30 seconds and just do as many as you comfortably can back and forth in 30 seconds, you can certainly do that. So the next one is just going to be what we call a supine butterfly stretch. So this is going to get the groin area. So with your knees still propped up, now you're just going to start bringing them out to the side. So I'm getting a nice stretch in the groin area here. This is kind of a modified stretch from the ones that you might see sitting up. Same thing, if you can't bring your legs all the way down without feeling some extreme tightness or pain in the groin area, you can bring it up a little bit. You could even kind of hold them if you want to get that stretch. But you want it to be that gentle kind of tension in there, but not painful. And again, since this is a stretch, it's going to be full 30 seconds. So just trying to kind of relax the body, get your head in a nice comfortable position too. I'm kind of turned looking over here, but ideally you want to kind of look up towards the ceiling and be nice and comfortable. 30 seconds, come back up, give it a little break in between, 15 to 20 seconds, and then do that 3 times just to get that nice stretch in there. The next one is going to be one of my favorites, kind of for the low back and the hips, is just a simple knee to chest. So this time you're just going to, it sounds like it is, you're bringing your knee up towards your chest. If you happen to have some knee issues, sometimes it's easier and more comfortable to grab underneath. You want your knee to come straight up. Sometimes if you've got some pain in the hips, some pinching, people want to kind of pull it out to the side. Really try and just bring it up forward this way. And now I'm feeling a little stretch in my low back and the back on that side. Again, it shouldn't be painful. If you don't have any knee issues and you want more of a stretch, some people come up on top like this, but that's a little bit more pressure on the knee. So again, nice full stretch, 30 seconds, come back down, switch sides. Some people might want to get a double stretch and get a hip flexor stretch on the other side, and then you can stretch that other leg out. You don't have to. Sometimes that puts a little bit more pressure on the back. That's why I like starting with it bent up. But if you want to stretch that other side out to get a hip flexor stretch on the other side, you can. But again, holding under here if you can, coming straight up, and I'm getting that stretch kind of underneath that low back area right there. And so that's a nice, good, comfortable stretch there. Then going into some exercises. So again, one of my favorites, it's a pretty easy exercise where you're not doing a lot of movement. So sometimes a lot of movement is what causes the increased pain or that flare up. So with this one, it's just going to be a pelvic tilt like it sounds. It's not a big movement. You're just taking your pelvis here and you're rotating it back into that posterior pelvic tilt. So you're not using your feet, you're not like pushing going up into a bridge. You're really using that pelvic floor area, those muscles in that area to kind of flatten out your back. So see, my legs here, my feet are, I can move them. I'm not using my feet. I'm using this whole area, this core here, to rotate back and then kind of flatten out my back. I'm not holding my breath. I'm able to talk while I'm doing it. And then just maybe like a 3 to 5 second hold and then relax. So you can see, I'm going to exaggerate. I'm going to come into the anterior pelvic tilt so you can see up this way, and then I'm rotating all the way back, getting that nice rotation in there. But again, using these muscles, not really using your feet to do it. Same thing, you can do it for time if you want to, just 30 seconds, how many you can comfortably do, that 3 to 5 second hold. Or if you just want to do it for reps, you can certainly do that as well. So then the next one, if you want to grab your ball or you can take a pillow and fold it up, it's really just to have something in between your knees so you can push into, so your knees aren't crunching together. Some people can use their hands, that's fine, but if you have a little bit of arthritis in your hands, sometimes that's a little bit uncomfortable. And then all you're doing is just squeezing into the ball. So now I'm exercising those adductors or that groin area, not pushing as hard as I can, especially with this chronic pain. You might just want to start off with 10 to 15% of what you think your hardest push is, just enough to kind of squeeze into the ball. Again, holding it for 3 to 5 seconds and then relaxing. So, you know, as you get going, if it doesn't flare you up, you know, do this for a couple days and then you can push in 25 to 30%. And then if you can get up to like 75% of what you think you can push, then you can start doing some active exercises with this. But this is a nice isometric exercise where you're contracting those muscles, but you're not making big movements that might really flare something up. And then you're just going to do the opposite direction out into the abductors, A, B. And so it's nice to already have something with a little loop on it because you can just bring it up here. Again, you can just use your hands kind of holding it out on the side, but then sometimes that stresses out your neck just a little bit. So having something solid like a belt, like a dog leash or a stretch strap works well too. And now I'm just pushing out. So almost like I'm going into that butterfly stretch that we did earlier, but the belt is preventing me from doing it. So now I'm exercising the muscles on the outside here in that isometric position. So I'm not doing the big movement with resistive weights that might be uncomfortable or painful or flare everything up, but I'm starting to get those muscles moving and strengthening. So again, 3 to 5 second hold, maybe just starting off with that 10 to 15% just to see how it feels and make sure that it doesn't really flare up anything super big. So then the next one, working on the neck a little bit, is just going to be what I would call a supine chin tuck. If you've watched any of my videos, I love chin tucks. They're my favorite. They're great for the neck. They're great for your posture. If you have headaches often, it's a nice way to kind of reset these muscles. A lot of time I'll do them in sitting, but doing them lying down, it supports your head. So a lot of times it's more comfortable if your neck muscles are really flared up. So all I'm doing, I'm going to keep my neck in a neutral position here, and I'm just pushing my chin downwards and my whole head into the pillow. So I'm going this way, where you get a lot of little chins right there. And then again, just holding it for 3 to 5 seconds and coming back up. Once again, you don't have to push as hard as you can. I'm getting a lot of movement just because I do chin tucks a lot, because I do have some trigger points and some neck pain occasionally. So I love doing chin tucks, and it kind of helps reset your posture as well. So again, pushing everything down and in, and then just holding that for about 3 to 5 seconds. Again, you can do it for time, or you can just say I want to do 5 at a time, holding that 3 to 5 seconds each time. And then a great thing to do is just some general diaphragmatic breathing, and that's breathing through your belly, especially with that chronic pain, that fibromyalgia type pain where a lot of times it can just get flared up. Doing that diaphragmatic breathing, because a lot of our nerves are kind of in that abdominal area, it just kind of helps calm everything down. So a great way to be able to do diaphragmatic breathing is place one hand kind of on your chest and then one on your belly. The one on your chest should really kind of stay in one spot, and you're breathing into your belly where your belly is going to come up and then nice and slow back down without this one moving a whole lot. So I'm going to breathe in and then breathe out. And sometimes it's a little hard to get it down. That's why the hands are nice to kind of get that visual so you can actually see your belly rising when you're doing it. So again, breathing in and breathing out. And again, you can just do it for time, or you can just do it, you know, as many times as you comfortably can, and hopefully that will relax everything back down. So there you have it. Those were some simple stretches and exercises lying down for fibromyalgia or chronic pain. If you'd like to help support my channel, click on the link up there, and don't forget to subscribe. Where the devil? Down there. And remember, be safe, have fun, and I hope you feel better soon.